my really great pleasure to be here today and present to you our work on dietary quality over time and child development. I want to thank Andrew for heavy lifting on the statistics part, and Nina Joshi, who's in the audience here, for immense help in implementing this project in the field. As background, I think most of you in this audience know that early child development plays a crucial role in enabling children to acquire needed intellectual skills and creativity to function as successful adults. It's been estimated that 250 million children less than 5 years of age in low and middle income countries are at risk of not reaching their developmental potential. However, outside of diet supplementation studies, relatively little is known about the linkages between diet, growth, home quality, and developmental status, particularly in resource-poor settings. And these relationships are rarely, if ever, examined longitudinally. Last year at this symposium, we presented our finding that consumption of animal-source foods and a more diverse diet in rather early childhood was associated with better development, even after accounting for socioeconomic status. However, clearly there was a lot more going on than diet. Thus, we were left with several questions, one of which was, is the relationship between diet and child development stable as the young children that we evaluated previously grew up? And secondly, what other factors, particularly measurable factors, could contribute to child developmental performance? These questions underlay the objectives of the present study, which are shown on this slide. First, we wanted to assess the diet of young rural Nepali children over a period of 4 years and to evaluate their developmental status at midline and at endline. We wanted to explore the factors which could influence developmental status and relate diet and these other factors to the child's developmental status. This slide and the following few slides outline the methods of this study. Our study on child development was nested within a community development intervention trial in Banki, Nepal, which was implemented by Heifer, Nepal. You can see in the schema the overview of how this study was done. There were 6 household visits made over a period of 4 years. On this slide, you see the information that we collected. At all 6 of the visits, we collected household demographics, anthropometry, and diet recall. At midline and at endline, we did developmental testing on the children. And at endline, we collected a measure of home quality and maternal depression. The home quality measure was derived from the Multiple Indicator Cluster Survey from UNICEF, and the maternal depression was a depression scale known as the EPDS. Since some of you may not be familiar with the child development piece, I wanted to spend just a moment talking to you about the measure that we used. It's called the Ages and Stages Questionnaire, and it consists of 30 age-specific items which are scored by observation in the domains of gross motor, fine motor, problem solving, personal, social, and communication. The results were analyzed by total score and by quartile, that is to say the lowest 25th percentile versus the upper 75th percentile. This is the kit that was used to test the younger children for their development. And you can see it consists of some toys and play items and other things that were used to do this testing. And here's the kind of item that was tested: the way the child interacted with blocks, activated a push toy, strung beads, or did a puzzle, or drew a person. So these were the kind of items that we tested at the household level. The participants of the child development study are shown here. At our midline survey, we included all 307 children in the project area who were between the ages of 23 and 38 months. At endline, we included all 629 children between the ages of 23 and 66 months. That included 207 children who had previously been tested at midline. The rest were too old for the ASQ test, which only goes up to 66 months. We also conducted a sub-analysis of 269 children who were evaluated at all 6 household visits and who had developmental testing at least once. Now I'll show you the results, and they're set up with the midline results on the top half of the slide and the endline results at the bottom half of the slide. Here you see developmental status compared to household wealth. You can see that for children, the children who scored in the upper 75th percentile had higher wealth scores in their household than children who scored in the lower 25th percentile. Here you see developmental status and mother's education. Mother's education was classified as none or minimal, primary or secondary, and you can see the very clear relationship between the child's ASQ score and the mother's education. Here you see the developmental status related to home quality, which we only obtained at the last visit. And again, you can see children whose ASQ scores were in the upper 75th percentile had a higher measure of home quality than those whose scores were in the lowest 25th percentile. This slide shows the results of developmental status and maternal depression. Rather concerningly, alarmingly, and surprisingly, there were more than 20% of the women in the project area were classified as depressed. And perhaps not surprisingly, after learning that, the ASQ scores, the developmental status of the children of these depressed mothers, was significantly lower than children of mothers who were not depressed. Now let's talk about diet. Here you see the dietary diversity scores and developmental status. Children with higher ASQ scores had higher dietary diversity than children with lower ASQ scores, and a very, very similar pattern seen for ASF consumption. We then wanted to look at developmental status and individual food groups. We asked the question whether there was a difference between the children who did consume in blue and didn't consume in purple ASQ scores. You can see that for milk, meat, eggs, and yellow fruits and vegetables at midline and endline, there were significant differences between the children who did and did not consume these items and their ASQ scores. Next, we conducted a sub-analysis of the 269 children with all 6 household visits. And again, to remind you, these children had complete dietary information over the 4-year period. Here you see an overview of the diet intake over these 4 years at the 6 household visits. At each visit, a child was assigned a score, 1 point for each of these items that he consumed. For example, if he had eaten eggs at 3 visits, the score would be 3. So the maximum score was 6, and you can see that for minimal dietary diversity, eggs, milk, meat, yellow fruits and vegetables, and animal source foods, the median and the interquartile range for these items in terms of the number of days consumed. So this gives an overall picture of the long-term inadequacy of the diet of these children. In other words, it was not just a single occasion, but rather a chronic situation. And this is emphasized by the inset here, which shows the cumulative dietary diversity score over this 4-year period, again, far below what it could have or should have been. Next, we considered age, sex, intervention group, maternal depression, maternal education, wealth quartile, and home quality as possible confounders of the relationship between diet and developmental score. We included confounders that influenced this relationship by at least 10%. That left us with maternal education, wealth quartile, and home quality as adjustments in our regressions. Here you see the results of the linear regression showing the increase in ASQ score for each increase in diet diversity score and the number of ASFs consumed in the unadjusted model in blue and the adjusted model in purple. While all of these are significant, you can see the marked attenuation in these results after adjustment. Here you see the increase in ASQ score for each day out of 6 that each item was consumed. Again, all of the unadjusted results for eggs, milk, meat, yellow fruits and vegetables, ASFs, and minimal dietary diversity were significant. However, after adjustment, we were left with just yellow fruits and vegetables and ASFs. Next, we attempted to construct a full model looking at some of the factors from the previous work that we knew likely influenced child development, including household wealth, maternal education, diet diversity, and home quality. Of these, only maternal education, diet diversity, and home quality were significant. And it is notable that perhaps we could consider diet diversity and home quality as some factors which could be amenable to further study and definitely to intervention at the household and community level. Our study had several strengths and weaknesses. As strengths, we had both cross-sectional and longitudinal results. We had cumulative dietary information 6 times over 4 years, and this allowed us to look at a very detailed picture of child diet. Possible limitations include the fact that the ASQ is not a gold standard test. In fact, it's considered a screening test, but we considered it to be informative and practical for use in the household under field conditions. Second, our home quality measure was self-report and not an objective measurement. And third, without a doubt, unmeasured variables likely affect these outcomes. Our conclusions are shown here. First, diet quality over time is associated with child developmental performance. However, the strength of the association between diet and ASQ was attenuated by adjusting for confounders. Second, multiple aspects of diet, and not just ASFs, are important. One example of this was the data that came out on the yellow fruits and vegetables. We don't know exactly how this is functioning, perhaps as a marker of diet diversity, perhaps in some synergistic way with other dietary elements, or perhaps some magic with vitamin A. We also conclude that environmental factors, including home quality, maternal education, and maternal depression, are associated with child developmental performance, and these act in some ways independently of diet. Our final conclusion is that in thinking about the whole child, yes, growth assessment is important, and we shouldn't stop doing it. But I have to say, as a pediatrician, I've come to believe that function is more important. We know that we need to have healthy, developmentally competent young children for them to grow up and become capable adults. As stated just this year by the World Health Organization, early child development is a cornerstone of human development and should be central to how we judge the success of societies. I want to thank Heifer Nepal, Heifer International, Valley Research Group, the Nutrition Innovation Lab for their funding, the participating families. So we should probably also thank a few goats for their participation in this project as well. So also recognize our US government partners, and thank you very much.